And that's where a lot of Americans are finding themselves right now with the high foreclosure rate. And have you read or do you know what the relationship between these healthcare costs and these foreclosure rates? Is there any relationship there?
Not the foreclosure rates. I think the Lincoln Journal-Star had an article recently that said some 60 to 70% of bankruptcies were as a direct result of medical bills.
So it's bankruptcy where
sure,
we're seeing this come up.
Right. And if you're close to bankruptcy, then you're probably not paying your mortgage.
Probably so. And then that, I would think, goes and stress hospitals and being able to go and provide those services in a cost-effective way if they have a significant portion of people unable to pay.
Well, they're called charity cases, and any hospital who accepts federal funding is required to provide free care for those who cannot pay for it. So I don't know what the formula is, but if there are more of us who come in through the emergency room who cannot pay bills, then that's going to put a strain, obviously, on the hospital, and that's going to make costs rise. I'm finding it difficult to understand people who talk about the cost of changing health care. It's that age-old thing, isn't it? You can pay me now or you can pay me later.
Absolutely.
If you don't do anything, then there will be more people who don't have health insurance, which means there will be more people who end up in federally funded health clinics, and more people who show up at hospitals who can't pay their bills, which will then create higher bills at the hospital for those who can pay, or for insurance companies who can, because there are very few private pay patients. It's a matter of changing numbers. You either do it one way or you do it another.
And then there's also that issue of we are spending a lot of money, but what we're getting is sicker as a society because we're not getting all the services that we need at the beginning, as you're saying, with the prevention. And as we get sicker, we get less productive, and it has an effect on the entire economy. So do you think that this healthcare issue is just issue for people our age that are kind of in our middle years or looking towards retirement, or do you think this is an issue that involves everyone?
This is an issue for every breathing American. I cannot begin to tell you how important it is that people begin to pay attention to these issues and not go all foamy-mouthed about the things that are being said about the health insurance. We have a problem in this country, and we have a problem that we have the ability to fix. And we have the ability to include everyone, which was what I thought was kind of the American way, was that we were all in this bathtub together, so we were going to have to help each other. I'm just a little taken aback at some of the rhetoric. I'm extremely taken aback by some of the incredibly ignorant things that are being said, and the inability of this country to come together for the good of everyone, not just because, you know, I've got my insurance, you go get yours, or we don't want you because you're going to run up the risk pool. This was not the way I thought Americans were supposed to be.
Well, today, which is August 30th, Sunday, we're taping. I saw in the Lincoln Journal-Star a very good article on the front page about a young man who had done 2 tours in Iraq, had a young family here in Nebraska, and a child, little girl, about 3 years old. His wife is expecting another child, and he suddenly came down with a horrible form of cancer, and as soon as that was diagnosed, boom, insurance company
and they found a very interesting way to cancel his insurance. They claimed that he was late on a payment, and she does admit that she was late on the payment. But there have been instances where insurance companies will go back. There's a very well talked about case right now about a woman who discovered she had breast cancer. The insurance company went back to read her records and discovered that she had gone in for acne, and acne wasn't covered, and the reason she found out she had breast cancer was through the skin test that the dermatologist was doing. So they canceled her insurance.
Oh, that's ridiculous.
So it is ridiculous. And I'm just, I don't think any company should have that kind of power over people.
Well, we have done things, and obviously we know all about the foreclosure and mortgage crisis and probably need to revisit that issue as well. But there are laws in place right now that say that if you're a little bit late with your mortgage, which is not good, but you don't just lose your house that you've paid on for 20 years.
They don't come with a bus and kick you out and send you out the door.
Yeah,
no.
For
no.
one late payment.
Correct.
By 2 or 3 days or whatever.
Right.
Yeah, I mean, there's a whole process set up that is meant to go and make sure that the consumer's rights are protected as well as the financial institution.
Right.
And there's a balance there. And right now, we don't have that balance in healthcare.
No, people who deal with insurance companies have very few, if any, rights when it comes to their policies.
Well, one of the things that troubles me is that I feel as though that in the United States it's a normal expectation that if you seek information, you'll be able to get it. But when I look at my insurance policy, you might as well be talking Greek, because I don't understand it all, nor do I have the time to read all that fine print.
It's an extremely difficult thing to understand, and there's no standard. Insurance can be different in Ohio than it is in Texas than it is in Nebraska. So you would think that in order, I mean, at the minimum, we can make this an easier process for people to understand their rights and have some sort of basic assurance of coverage, and then to make sure that people don't go uninsured.